So tonight we're just going to talk a little bit about risk communications and outreach for MRC volunteers. Just wanted to share a little bit about that. I am the risk communications manager. I've been with VDH for about 8 years. And there goes the thing. Sorry about that. About 8 years, and Linda, who's doing the chat, just started a couple weeks ago, almost a month. So welcome to Linda. We appreciate her being with us tonight. So this is a little bit about what we're going to go over tonight. Introductions, we'll do that in a second. I really want to keep it a little bit interactive in the chat box. So I appreciate everyone already telling us who you are and where you're from. And then we'll talk a little bit about public health communications, and then some theory of communication and basic communication theories and ways that we can communicate better. And then prevention messages, which is a lot of what we did before the pandemic. I know during the pandemic, we're mostly doing emergency communications, but we used to do a lot of prevention here as MRC. And then we're going to talk a little bit about COVID, because that's what we're mostly focusing on for the last almost 2 years. So in the chat, I know several have already done it. If you could throw your name up there just so you can introduce yourselves to everyone and say hello, how long you've been in MRC, which is optional. You know, some people have been with MRC a very long time, and we have a lot of new people as well. But let's see who we have. Oh, we have someone who's been with us a year. Thanks, Beth from Fairfax. Mary, I see C. Hi, C. Davis up in Lord Fairfax. Appreciate seeing you there. I see some familiar names. All right, Chesterfield, Virginia Beach, got the Eastern region there, Central region, and Northern, and Western. All right, Warrenton, I don't live too far from there, and Woodbridge is where I'm based out of. Loudon, great, okay. I've worked with the Loudon MRC some in the past. Richmond, volunteer and training, cool. Sterling, yep, Charlottesville. All right, lots of folks. Alexandria, near Southwest, super. I follow all of you on your social media, all of your MRC units, all of them I can find, I follow. So I'm sure I've seen several of you in those lovely pictures that our folks post. All right, well, thanks so much for doing that. And now I feel like we know each other just a little bit better. All right. Henrico, great. Herndon, super. All right. I think we have almost 140 people on the call. So welcome to everyone, 158 now, super. So I wanted to talk a little bit about persuasive communications. And when we used to do this in person, we would go around the room and everyone would talk about something, but we're trying to utilize the chat here on the virtual. So we want to talk about like a time when someone is effectively or ineffectively engaged you, either in trying to sell something or to persuade you to do something. You know, maybe your spouse wants to go somewhere on vacation and you want to go somewhere different, or you run into someone in the mall who's trying to sell you perfume and they spray it on you, something like that. Anybody have any fun items about persuasion? I know it's Christmas time or holiday time, so maybe some of your kids are trying to persuade you to buy them a present for Christmas or your holidays, or their birthday even. The invitation to the training. Yep, we're trying to sell you on the training. I hope something in that was persuasive because you showed up, so that's great. We appreciate it. All right, nursing shoes. So they talked about the benefits of them. Yep, the mall sprayers, yeah. Your grandson always gets you to buy him candy. Okay, super. It's hard to refuse when they ask for things, isn't it? So think about all those things in relationship to how you're trying to persuade people. Buy a car and the salesperson didn't remember any of the criteria you told them. Yep, car dealers. Yeah, that's a different one. Yep, friendly demeanor, that's important. Dance classes, yep. Telemarketers, yeah, I don't like those. I don't answer my phone anymore because of them. Yeah, so many people are concerned about your auto warranty, aren't they? Discussing, yes, we'll talk about why someone should be vaccinated. Buy a horse and you got a dog, bait and switch. Great, great. I hope that works for you. Give a little of what they want first. Car dealers ask how much you can afford for the month instead of how much the car costs. So they're talking about the short term versus the long term. So it'll hurt only, $350 a month, but over the life of it, you'll have to be paying for it for 7 years or something, right? Yeah, staying home. Does that sound like something you'd like to do? Getting them saying yes. I know that's an important thing that some salespeople use. All right. Well, thank you all for that. That was good to get you guys typing this evening. So let's talk a little bit about some things that run into specifically health communication, some things that might prevent us from hearing the message or getting the message across to people. Things like uncertainty or complexity. I know with the COVID, everything is very complex. Now we have this new variant, the Omicron. We're talking about that and how complex it is. We don't even know everything about it, and that we're uncertain about what it's going to do. Distrust of the government. I know that's at an all-time high. Distrusting science. Sometimes people don't trust young people. Sometimes they don't trust older people. Excuse me. If there's conflicting evidence, I know there's at least 2 sides to every story, and it seems like there's a study to conflict with every study that's out there on anything medical. So that's kind of difficult. And then selective or biased reporting by the news media. I know we've all run into that with the COVID and a lot of other things. And more obstacles, things like rumors and misinformation, fake news, or fact checking. People are trying to fact check, but where they fact check, who can they trust? Sometimes emotion overcomes logic, especially if it's something that's affecting you. I know we've had change of heart a lot of times with folks who didn't want to get the vaccine, and then they got sick and were hospitalized, and now they're the biggest vaccine proponents because their emotion got the best of them, when they didn't want the vaccine, and then they had an experience with it. And so they changed their minds, and it kind of took that to change over their beliefs. And then language and culture. There's certain cultures that have a bigger distrust of certain parts of the government, or certain people who are not like themselves or who are different than themselves. Sometimes you have those issues underlying things. Things like language. It's hard to, we talk about transcreating things instead of translating them, because sometimes you don't say things the same way in a different language as you would say them in English. So we need to make sure that we're being culturally sensitive when we transcreate things into other languages. And then physical presence versus virtual. I know it's different. I've had to adjust to doing trainings on a computer instead of in person. I can't see how you're reacting, so I don't know if you're believing what I'm saying. I can usually get that from the cues on your face. And also with people wearing masks now, it's very difficult to see people's facial expressions. And I don't know about you, but a lot of times I will take someone's cues from how they're looking back at me and see if they're following me. And you can't really tell that if someone's wearing a mask underneath their, to cover their mouth and face. And so here's some outreach. So I thought maybe we could be interactive on this one as well. So think about what we're trying to say with some of these graphics. What do you think this Coca-Cola is? The smaller Coke has this many sugar cubes in front of it, and this Coca-Cola bottle has this many sugar cubes. So what do you think that's trying to show? All right, no one's answering. Sugar content, portion size. Yep. And then here's a person trying to open a medicine bottle. This could mean a lot of things to a lot of people. I mean, some people might look at the hands and think, oh, that's an elderly person. And we're talking about elderly folks not being able to open child-proof containers. And so we need to make things easier for them. It might be that older people may be taking more medicines. It could be about opioids, making sure that you secure your bottles from children and folks. Yep. And then how about down here? Do we have any emergency folks down on the phone? What do you think this do-it-yourself emergency kit's trying to show? Yep, be prepared. Preparedness. This is a way that, you can do it yourself. It's not going to cost a lot. So we try to make it easy for people is what we're trying to communicate and show exactly what to do. That's a whole lot of stuff. Yes. Maybe you don't need 4 flashlights, but maybe. Okay, so this poor little girl, I love this cute picture of the poor little sick girl with her thermometer there. So what do you think we're trying to say? How to take a temperature for a child. The poor baby has a fever. Don't send her to school. Yes, that's true. I think we use this a lot on flu. You don't want your child to feel like this, so get them the flu shot. Yes, preventable. And then, of course, the ready.gov, get a plan, make a plan, be prepared, stay informed. And then right here, the fight back, have people seen the bacteria there? So that's about food safety. So these are all things that, a lot of things we used to do before the pandemic that we helped promote in our communities. Things like food safety, when in doubt, throw it out, that kind of things. Yep. All right. Thank you guys for participating. Fight back is not clear, right? Yeah. That was kind of an older one. I don't know that we would put that on its own, but we might have it, in the corner of a document that has some more things in it, like talking points. All right, let's talk a little bit about changes. So people don't really want to change. Everyone likes the status quo when it comes to themselves. They have beliefs they don't want to change. They have values they don't want to change. Their traditions and culture. If they've got experiences that, show that this is the way that things work and why do I want to change if what I'm doing is working fine? I haven't gotten the COVID vaccine, but I haven't gotten COVID either. So why should I get the COVID vaccine if I have experience that shows I don't really need it because I haven't gotten sick? So, things like that. Anecdotal evidence, again, I know somebody who got the vaccine and they were sick. And so I don't want to get the vaccine because I'll be sick, that kind of thing. Distrust of authority. We talked about that a little bit earlier in our authorities. And then things like inertia or resistance to change. Again, the status quo is where we are and we don't really want to change when we don't have to. So it's going to take a little something to get people to change. And that's when the health belief model comes in. This is one model that we've used in the past that's been developed by people a lot smarter than I have, who've done a lot more research on things like this. And these are kind of the steps that you go through to try to get to change someone's behavior. Because basically what public health is about is changing people's behavior to be more healthy for themselves. And so that the community is safer. So you want to think about the risks of the current behavior. So if there's no risk of your current behavior, it's very difficult to convince someone to do something differently. Because, why should I change if what I'm doing is not risky at all? So you want to make sure that you consider those risks and, explain those to folks. And then you want to talk about how serious they are. Because if it's a small risk, like, teenager smoking is one thing, because a lot of teenagers don't realize that, hey, one day, way in the future that I can't even imagine, I might get, lung cancer from smoking. So they don't really think about that as a very high risk. But if I jump off this bridge and fall into the river, I could drown. I mean, that's an immediate risk, things like that. Things are much more serious if they're much more immediate or much, if you could die from something as opposed to just, get hurt or have it happen way down in the future. And then you want to recognize the benefits and the motivators to change the behavior. So some of the benefits to things like quitting smoking is, your breath doesn't smell bad. You can, a motivator might be all the money you save can buy you a new Xbox, or, can go towards a down payment on a car when you turn 16 if you don't start smoking. Or, for older people, your teeth aren't yellow if you're trying to date someone and you don't want yellow teeth because you're smoking, things like that. So those are some motivators to change behavior, for something like smoking. And then overcoming the barriers. So things like addiction, we want to make sure we provide ways that people can overcome the barriers. Addiction is a huge barrier. People always say they know how to quit smoking. They've done it a million times because it's hard to stay quit. So that's one of the barriers to that. And then using effective strategies like you can do this and here's how, might be something like the Quit Now line. We have the Great American Smoke Out every year where we promote the Quit line where people can call and get counseling. We even have a texting version of that now for younger people who are into the texting or people that want to stay more anonymous and, not have their voice, have to talk to someone in person. They can actually text now for some support if they want to do things like stop smoking. So that's kind of adapted from the health belief model. And it's a very complex model, but these are the main points on it. So. And yes, that's true. Sometimes it is more about overcoming the why rather than the how. So that, let me go back one. So that talks about things like seriousness of risks and, why you should change, benefits and motivators. So why you should change would be identifying some benefits. So that's a good point. Thanks. Just want to check in with Linda. Linda, did you have anything from the chat that I missed?
No questions yet.
Okay, well, thank you guys for commenting and questioning. That's good. All right. So the next one is, this is kind of applying this to a scenario. So anyone want to, let's do a little improv. So think about a scenario, what kind of things that do we want to put out there about prevention? Think about something that you might want us to go through this process in number 2 with. What are some of the prevention messages you think are important to get out there? I see Tammy has put down one on sugar, so that's good. Speeding, that's a good one. Anyone else have any scenarios they want to talk about? Mask wearing, okay. Smoking, won't vaccinate, drinking and driving. Drinking and driving is a good one. Seatbelt, smoke detectors, pregnancy, obesity. Safe sex, that's a good one. We do a lot of education on that. Violence, diabetes, salt. Yeah, I have to worry about salt now too myself, so that's a good one. Vaccine preventative disease, public health, STI, vaccinations, texting and driving, suicide, booster vaccine, drinking, texting and driving, mental health, opioids. All right. If I knew how to use Zoom better, we'd do a vote, but let's think about, let's see, routine, walking and texting. Yeah, I've done that before. All right. And let's talk about, we had a lot to do with driving. That was interesting. We had seatbelts, we had speeding, we had drinking and driving, things like that. Let's talk about drinking and driving. Let's do that one, okay? So drinking and driving, who would be your audience? Who do you think are drinking and driving? Teens? Okay. Yep, teenagers. Early 20s, yep. Young adults, yeah. Okay, so if we think about that, age, gender, both genders do that. Suburbs, non-urban, college students. Yep, college students, that kind of covers the late teens, early 20s. Everyone, right. So let's go through this one. So speeding or drinking and driving, and I guess speeding would be part of that. So what are the risks of the current behavior? What happens if you drink and drive? Let's put that in the chat. Death, accident, harm yourself, harm your others, loss of awareness and inhibitions, threatening others, killing yourselves, accidents, injuries, fatal, lose your license, get arrested, crash, jail. Yep. Okay. Criminal record, you could lose your job even. I mean, I know, my job requires me to drive. If I lost my driver's license, I wouldn't, I might not be able to drive, have my job. I guess I don't drive much anymore during the pandemic. Loss of freedom, financial, yeah, paralysis, that's horrible. Yeah, your friends would have to drive you everywhere. Okay, so some of those are serious and some of them are less serious. Ruin others' lives, yes, a lot of those are very serious. Yeah, guilt, I can't imagine that. Yeah. So there's a lot of the seriousness. I've seen some of the commercials on TV. They talk about, do you want to lose your license and, go to jail? And, they don't even get to the point of the really serious things like, killing someone by running over them or running into their car. So that's a good bunch of those. Okay, what are the benefits or motivations to change that behavior? I know a lot of times we just say the opposite of those things. Saving money, safety, life, money, taking care of your friends. That's good. Healthier, right? Peace of mind. No troubles, right? Keeping your freedom, family, your job. Right. All right. So those are some of the benefits and motivations, is avoiding all of those serious risks that we talked about. Overcoming barriers. So how could you overcome a barrier? I guess this would talk about things like, if you're out drinking, what's going to keep you from driving? How are you going to get home, I guess is the point. Designated drivers, yep, Uber. Uber has been great now, and everybody has a cell phone that they can, put that app on there, give someone your keys. Drink limits at bars, Quit drinking. That's lots of, benefits to that on your health. Share your commitment, designated drivers, right? Having someone that your safety person that you can call. I know children, they talk about that. Teenagers, the parents will, make a compact with them. If you had too much to drink, you can call me, I'll come get you and I won't punish you or something. Testing before you drive. I know that's done. They have the breathalyzer thing on some of the ignition locks. Overcoming the I know when I'm okay to drive thing. And that's the whole buzz driving is drunk driving campaign. If you've heard that one, it's like, even if you're just buzzed, you're not good to drive, kind of thing. So overcoming barriers is finding ways to get around driving drunk, so that finding another way to get home, finding a sober person to take you home, getting Uber, spending the night, that kind of thing. Planning ahead. If you're going to drink, stay at a hotel, within walking distance of the party, or, if you're going to a party, like a New Year's party at a hotel, get a room so you don't have to drive afterwards. Excellent. Okay. And those are some of the effective strategies. Overcoming the barriers kind of bleeds into the effective strategies. So excellent. You guys are just naturals at this. Great. So let's talk a little bit about your message. So your clients, and I guess that's just the people you talk to. I couldn't find a really good word for that, but they're going to judge your message by its content, its messenger, and its method of delivery. So there's many areas that people are going to, look at. It's not just the words, it's the messenger and the method of delivery as well. So let's talk a little bit about how to formulate those messages. Yes, walking drunk has its own problems. Yikes. Yeah, and riding a bike while drunk is probably not a good idea either. All right, so let's talk about communications basics. So some of the things that reinforce good communication is frequency. So they say if you hear something a number of times, you're going to remember it. So we want to make sure that when we're talking to someone, we repeat things in different ways so that they hear the same message. And this is where like taglines come in, don't drive drunk, or buzz driving is drunk driving, things like that. So we want them to to hear that message several times. Being interactive when you're listening to someone, you want to make sure that you're hearing them, not just listening. And we'll talk about that in a couple of bullets there, but you want to make sure that you're, making good eye contact, being an active listener and interacting with the person so that you're sure that you're understanding them and they're understanding you. And just talking is not communicating. And this is why I'm trying to get you guys to help out in the chat there, because, talking is not communicating. I can talk at you all night, but I don't know if I'm communicating because I don't have the feedback from you all. So I really like to see the feedback in the chat to make sure that you guys are hearing us and understanding it. And again, hearing and listening are different. I know it kind of reminds me of the old Charlie Brown cartoons where the teacher was going wonk, 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 wonk. And the students, when that's all they were hearing, they weren't really listening to the teacher and hearing what the adults had to say. I guess all the adults sounded like that in Charlie Brown communicating. And then I see some good comments going through the chat, but I can't keep up with them. So we'll stop at the end of this and take some of those up. And then we can hear without choosing to listen. Again, people can zone out, and, with the advent of internet and, video games and our telephones, sometimes we can be in the same room with someone. They can be talking to us, but we're, checking our phone and not hearing what they're saying. So we hear them, but we're really not listening. And then engaging for action. So we definitely want to make sure that whatever we're telling people enables them to engage for action and not just, think about it. We want to give them something to actually do with that information. And so there's my little cartoon. It says, "You weren't listening. I said, don't fall." So sometimes, that person heard him say that, but they didn't really understand it because they weren't listening. All right, I'm going to stop and look at the chat for a minute. What do you have in the chat for us, Linda?
Yes, we had one question. How do you avoid being judgmental?
That's a hard one. I know I don't have a very good poker face, but I really try not to judge people when they say things, very, I'm trying to be crazy. I did get a call one time from a person who literally thought that the Affordable Care Act was going to put a chip in her brain. And I really didn't realize that that's what she was talking about till the end, because I just heard a scientific article about putting chips in people's brains to stimulate the brain and make it work better. And it was an actual real operation. It wasn't someone trying to control your brain because you joined the Affordable Care Act. So yeah, it's really hard to not be judgmental, but you just kind of have to put yourself in their shoes and try to be empathetic. And we'll talk a little bit about empathy. Communicating without badgering, I see. Yeah, that's hard too. We've talked about that with COVID, because it's really hard we don't want to guilt people all the time, because then they kind of back off. And I see someone put, "Can you repeat what I'm saying?" So that's a good strategy also, is to say, repeat what they're saying, "So I understand that what you're saying to me is this," and, sometimes you ask them, "Well, do you understand what I'm saying? What am I saying to you?" Again, giving just the facts. Anything else in there, Linda?
That was the last question for now.
Okay. Right. If you're tracking someone, it's okay to say, I'm not sure I follow. Tell me more. Yeah, exactly. Asking leading questions so that they can explain more. Yeah, facts don't work when the opinion wasn't based on fact and logic. That's true. It's really hard to convince someone and again, that was the emotion trumps the logic. So you don't, you sometimes feel that, they're being emotional about something, and you can't tell someone to stop being emotional. You can hope that they calm down and hear your logic, but a lot of times if they're extremely emotional. And that's another thing about communications theory. There's theories that say that people do not hear as well when they're emotional or under stress during an emergency. They don't remember things as well. You need to talk in shorter words, just so that they understand you. Tell me why you feel or think this way. That could work if they're not feeling like you're being judgmental. So that's a good one. You could instead of you should, right? Calm and patient tone. That's a good way to not be, condescending or patronizing. Okay. All right, let me go back to the next slide. All right. So here's some points about being an active listener, and this can help towards getting folks to, believe you and trust you better, than someone they just met. So, you want to be an active listener. So things like looking at the speaker, making sure that you're turning your body towards the speaker and not, just kind of throwing your voice over at them. You want to make sure that you're paying attention to them and being in the moment, making sure that they understand that you are, they're important and you're listening to them. Nodding or giving verbal encouragement. I do this a lot. I actually went to school for journalism, and I can't be on TV because I nod my head too much because I really agree with everything that people are saying. And it's not that I agree with it, it's I'm encouraging them to keep talking. So I do nod my head a lot. Try to concentrate on what's being said. Again, being in the moment is very important. And I know with everyone multitasking these days and the pull of the cell phone message when it goes ding, things like that, just try to, make sure you're concentrating on what's being said to you and, see why they're saying what they're saying. Again, like the person put in the chat about, the why instead of the how, or, just why they're acting that way. So you want to make sure you understand them. And then asking clarifying questions. Again, like someone said in the chat, can you tell me why you believe that, or why you think that, or, where did you find that evidence that, such and such happens if you take the vaccine? Maybe that's, less than true, things like that. And then here's some avoiding things. So again, we talked earlier about, avoiding being patronizing or looking down on people or judgmental. So you don't want to criticize people for their beliefs because that's going to turn them off, right away. And then second guessing, you don't want to think what they're going to say, or, things like, oh, I know what you're going to say. You're going to say this because you're just like all those other people that think that way. You definitely don't want to, be that way to folks, because every person's an individual and they deserve your, attention when you're trying to discuss with them or help them. You don't want to discount their beliefs and say, oh, well, that's a silly belief. No one wants to hear that. I mean, think about, a lot of this is just putting yourself in their shoes and trying to figure out what they would not want to hear and avoiding that. So you don't want to lecture them or placate them or rationalize things that, that they think are accurate, or generalize. You don't want to generalize that all of, people who hate vaccines are this way or whatever, because they may actually have a really good reason for believing the things that they believe, and you don't want to generalize people. And you don't want to let your feelings interfere with your ability to communicate positively. And this is another one about not being judgmental. You don't want to let your feelings get away from you when you're dealing with someone who may have a different belief than you. And I know that's difficult, but as an MRC, you're here to help people. So don't want to convey disgust, frustration, indifference, or fear. You don't want to be visibly disgusted by what they're saying or frustrated with the fact that they believe it. And you don't want to be indifferent to it either. You want to care, or, show that you care. And you don't want to be afraid of people, even if it is a little bit disconcerting, the things that they might say. And then again, citizen feedback, this is always very hard. And it used to be less hard before COVID. COVID has brought out a lot of angry people with beliefs that are very ingrained. And so, trying to say things like, I hear you, or I hear your point, or thank you for sharing that with me, or something like that, that gives them validation for existing, basically. You don't have to agree with the position, but, you want, to thank them for communicating with you, and, make sure you acknowledge that. And then this is just a general thing. And I'm sure, in your MRC, training, you've been asked not to answer individual medical questions because we are not a doctor's office. Even if you have medical training, we encourage you not to give medical advice to someone because obviously you don't know their whole medical history or, comorbidities or medications that they're on or anything like that. And I'm sure, you all, as any of you who are medically trained, know better than to do this when you're acting in an MRC function. And then it's okay to say, that's a great question, I don't know the answer. If COVID has taught us one thing, it's that we don't have all the answers. We don't know exactly how the new variant is going to respond to vaccines. And, we might all have to find that out together. And, we want to wait until we know more after some studies have been done and, the scientists are looking at it, that kind of thing. And then turning negatives into positives and always bridging back to your key messages. And this, the next slide is going to provide some bridging comments, and these are actually useful both as an MRC or in your personal life too. But let's look at the chat real quick just to make sure I'm not missing anything. Let's see. And then being at the same eye level, we do talk about that. I think I have a slide about that, being at the same eye level, the physical presence, I think is what I called it. That was on one of the earlier ones. Getting down to the same eye level as someone really helps reassure them that you're not towering over them or threatening them. Nancy's mansplaining, that's good too. We don't want to, and that's kind of like patronizing. It can be man or female, nannying, right? Exactly. Yes, best refer them to their healthcare professionals. And sometimes that may be their doctor, it may be an urgent care, it may be a clinic. Some people actually go to their pharmacist and talk to their pharmacist about things. And in some of the communities where people can't get to their doctor, their pharmacist becomes a de facto healthcare professional that they can talk to. You think about your own inability to give up believing Pluto is a planet. It gives you perspective. Okay, that's a great way to do it. Whatever works for you, man. That's great. Thanks, Chris. All right, so let's go. These are a few actual things you can use, today in your life to talk to your families, to talk to your clients, your folks that you meet when you're out working as an MRC. They're called bridging phrases, and this is when someone's trying to lead you down a different direction. And we use this also in media. And if you look at these when you're or think about these when you're watching the news, you might hear some of the folks being interviewed use these in order to get back to their what they call their main points or their key messages. And so what you want to do is have your messages, in the back of your mind. And then if someone is going in a different direction, you kind of want to redirect the talk back to the most important things that you want to get across. These are some of the phrases you can use. So if someone is getting down in the weeds about something and, 1 in 6 million people had this side effect when they got the vaccine, you can say, well, what's most important is 6 million people have been vaccinated. And, that's a great step towards having immunity in our community. And a lot of those people are fine and they're avoiding hospitalization and death because they've been vaccinated. What we should focus on. So again, if we're focusing on something that's not the main point, we could go back to things that we can focus on. And again, you can't say these in a patronizing way. When it comes down to it, you have to be genuine, and you can't be fake about it or trying to fool people. You definitely want to be genuine about all of this. And then what the public should know is, so again, you're part of the MRC, which is part of the Virginia Department of Health. And so we are authorities, and actually public health is one of the more trusted, next to doctors or nurse practitioners, are one of the most trusted sets of folks to give advice on things like the pandemic and other medical issues. So we are trusted. So we can say what the public should know is, because we're the ones that have that information and we're trying to get it out. And then that speaks to a larger point. Again, if people are getting down in the weeds, we want to get back to the larger point and the bigger issue. And then again, it's not wrong to say you don't know the answer, because you may not know the answer. I don't know that answer, but what I can tell you is sometimes the answer is unknowable because we don't know the future. We don't know how we're going to turn out or when we're going to get out of the pandemic. That's what everyone's trying to ask us now, is when are we going to get out of this pandemic? And obviously we don't know that answer, but what I can tell you is we need to continue the mitigation, the wearing the mask, the staying away from people. We need to stem the spread. So that's kind of a thing. Just so can people think about how you might use these in your MRC volunteering, or maybe in your personal life? How might you use those phrases? Anybody? Okay, no one has an example? All right, we'll go on to the next slide. Oh, sorry, repeat the question. Yep, redirecting your, so I was just asking what kind of situations might you use this kind of information or these bridging phrases? Quality compliance, okay. All right. Talking to people that don't want to be vaccinated. Yep, redirecting the conversation. When your technician is unable to answer and request your advice, okay. When people want to argue, turning a negative into a positive, talking to people about minimizing by wearing masks. Right, okay. Good, excellent. Good points. So let's think about some emergency events that you all might go to. I know a lot of what we do right now is COVID. Right, redirecting to reliable sources, someone says. Excellent. So emergency events that you all might go to, things like clinics, points of dispensing, used to be for flu vaccines, now it's mostly COVID. COVID vaccination clinics or testing sites, flu shot clinics, things like that. Some kinds of environmental hazards you might be called in to help out with, things like outbreak investigations, some things like weather events. You might be asked to volunteer in a shelter, for example, if we have a snowstorm. And then things like drills and exercises. Have you all done drills? If you've been with us for a while, you used to do drills, now it's all just live emergency. Yes, that's one big hypodermic needle. I don't know what that's for. All right, excellent. So these next slides, I'm going to go over a few events. So if you feel like it, you can type in the chat what you think these are. The first set are natural disasters, like weather disasters. So what do you think happened here? Tornado, yep, tornado, that's probably a tornado, excellent. So that's something that we could have. Not sure we're gonna get that. Yep, it could be an earthquake too. Snowstorm, yep, blizzard, exactly. That could be something that we have to react to as in an emergency response. And then these are some of the other kinds of things. You could have something with drinking water, maybe. We've had boil water notices when we have sewage leaks that get into the water system, or the pressure is down because of a broken water main, frozen water mains. So we might have to do something like that. Food safety. And then there's a mosquito, Zika, West Nile. Yep, exactly. Contamination. All right. Dengue fever. Yeah, we might actually have that in the US more than we used to. E. coli, Zika. Yep. All right. What about these people? Flood. Yes. Should we be walking in flood waters without big, tall boots? No, we should not, because things can get in there that can contaminate and make you sick. Sewage. Yes, exactly. All right, excellent. So let's do some man-made ones, or at least man-involved, more built environment issues. Okay, so that one, everyone knows what that one is. Yes, sadly, we all do. So that was 9/11. And then this is what is this one? Fire, yes, building fire. So those are very things that can have effects on the folks around who were in the fire, who were around the fire, who lose their homes because of the fire. We could need an emergency shelter, that kind of thing. How about this one? Anybody remember shortly after 9/11, what happened? Anthrax, yes, anthrax in the Postal Service. So you had mailmen driving around in hazmat suits. Kind of scary. And then these are another one. Something someone said earlier could be a health effect of this. What do you think is going to happen when all that smoke hits the community? Right? Could be hazmat, depending on what the train was carrying. Look at that black smoke. That's terrible. So all of these things make people nervous, or stressed. And, you're going to have to deal with that if you're working with the folks that are affected by these disasters. So that's one of the reasons we talk about risk communication. So here's some more information about delivering the message. So these are some of the goals of risk communication. So before we were talking about prevention, and now we're kind of talking about risk communication. And the pandemic kind of goes on both sides. It's been going on so long. It seems like prevention, but it's really about an emergency that we've been in an emergency state for almost 2 years now. So all of these communications can be used for things like that, but especially in a risk communication situation, we want to show empathy for fear, confusion, and frustration, because all of those slides we just showed can cause those emotions in people. If it was your apartment building that was on fire, if your loved one was on that train, or worked at a post office, or worked, God forbid, in New York during 9/11, all of that is going to make you really frustrated and afraid and sad and upset. And so we need to make sure we show empathy for that. And then we want to empower the audience to make informed decisions. So the idea is not to make people do something, it's to empower the people to do the right thing. One of the big risk communication goals is to get the right information to the right people at the right time so that they make the right decisions. And so that's kind of our little wheel in communications, emergency and risk communications, is to try to get that information out to people so that they make the right informed decisions for themselves and for their community. And we want to discourage negative behavior, i.e. walking in a flood, flood waters that could be contaminated. And we want to encourage constructive actions. And one of the things we do, that's one of the reasons we tell people to get a kit, make a plan, stay informed, is because that gives them some sense of control over an emergency. So if you have an emergency and you have to evacuate your home and you already have a kit together, you're not running around throwing things in a box that you think you may need. So we want constructive actions for people to do. This is one of the reasons after events. I know, we had the Afghan refugees coming to our community because I live up here in Northern Virginia near Quantico. And so we had a lot of folks gathering stuff for them and trying to make a difference and being constructive. And, the moms need diapers and formula. And, they also need, things like clothes. And, they came here with nothing, and let's help them. So people in an emergency sometimes have really, great, beneficial emotions towards folks, but you have to, kind of give that some sort of direction and encouraging constructive actions. So that's another reason that we think about that during risk communication. And then just some caveats. We don't want to reassure people, for example, if this happened to someone's house, everything's not going to be okay right away. You're going to go through some tough times. You're going to have to, find a place to live. You're going to have insurance, things like that. If someone, was walking around in sewage and they got an infection on a cut, something like that, they may have sickness and have to go to the doctor and be on antibiotics. And there are some good comments in the chat about things that happen after hurricanes. It's people attempting repairing their own homes instead of waiting and getting it repaired, later or when it's safer. And then when you're talking to people, you want to make sure to repeat or relate general facts about the incident or event. So that's kind of what we fall back on when we don't have a lot of specific brand new knowledge about an event. You just repeat the same information that Again, repetition is important, so we want to make sure we repeat things. If people hear the same message over and over, then hopefully they'll start to believe it. And then limit that information to what's been released. I know it's frustrating if if you know something that you can't tell people, but there's a reason that information is released in the order that it's released. We don't want to cause a panic or spread rumors or misinformation. So the information that's been released has been through the fact-finding process, and it's been fact-checked so that we know that it's accurate and we know that it's not a rumor or misinformation or something like that. And media is famous for reporting things too early without confirming, so we want to make sure that we don't contribute to that. And then we want to admit what we don't know at present. I think it makes a lot of it goes a long ways towards getting people to trust you if you are honest with them and you admit you don't know things right now. We don't know how this new variant is going to affect us. We just don't know yet because we haven't experienced it. So we need to wait and see how it's going to happen, or wait for the studies to happen. So it's okay to admit that you don't know things at present. No one is expected to know everything, and we just need to be honest about that. And then specifying corrective and protective actions to take to protect yourself and your family. Some people like to control this situation. In an emergency, there's no way to control it. So giving them something to do and some way to do to protect their families is very important to a lot of people who need to have some sense of control so that they don't feel helpless in a situation. And that's the last thing. Here's what you can do. So that's a good thing that you can share with them, is what they can do to protect themselves and their family. And then, so that was mainly the general information on communications I wanted to share with you, but I did want to talk a little bit about COVID-19 communications, since I know that's what a lot of you guys are probably working on at the moment and have been for a while. There's some general information you can share, things like, 1-877-VACCINE-VA, or your local hotline if your health district has a local hotline. Encourage people to call that if they have questions about COVID. We're getting, thousands of calls a day. It's amazing. It's a great resource. Go to the vaccinate.virginia.gov. That's a great website. That is easy to remember and gives people a way to register to vaccinate, or if they've misplaced their vaccination card, they can get a replacement document or vaccine record. They can even download it onto their phone, which is cool. You can join the COVID ambassadors. This is our community ambassador program, and Linda's posted that link there in the chat. I know you can't click on the screen, but there's that link right there if you want to join our COVID community ambassadors. I don't know, is anyone out there a community ambassador for COVID with VDH? It's a fun little program. They actually give tasks or missions. They call them missions. So they each every couple of weeks they have missions they encourage people to do, like, hey, do you have you shared information about how to get vaccinated on your personal Facebook? Please go out and do that. And we have about 3,000 or 3,500 ambassadors across the state who've signed up to do this. And it's kind of like a force multiplier where we get people to go out and share the vaccination or testing or COVID messages that are accurate with their friends and families. And then we encourage you to follow VDH and your health districts on social media and share those messages. Those are going to be accurate because they're coming from a good, reputable source. And the more folks that share those with their followers, they can be influencers in the community. So that's great. And then your MRC units would provide you with resources for outreach if you're actually at an event or something like that. So, please talk to your MRC coordinator about that if there's materials that they have that they'd like you to give out. It's different in every health district. So, yes, and Spanish too. We do have some Spanish things, yes. We are trying to get a lot more things in different languages, so we appreciate that. All right. Let me check in with Linda. Linda, we got anything in the chat we need to talk about?
No questions, but the common thread has been how to effectively address vaccine refusal.
Yeah, that's very difficult. We've got a lot of hesitant. We're working on some vaccine hesitancy marketing and things like that, and so we're hoping to get that information pushed out. So just follow our VDH and health district social media. We should have some hesitant information coming out for folks or graphics that hopefully, convince people. You're not going to change someone's mind with a 5-minute conversation. It's going to take a while. And, there's different people that are, hesitant on the fence, or are they hesitant they're never going to do it. So you can't move someone who's 100%, 100% in one direction or the other. We had all the people that came out and got vaccinated immediately, and then it kind of slowed off. And now we're trying to get those few that are on the fence in the middle. And, there's a lot of people you're never going to convince, and you're just going to beat your head up on a wall trying to, convince them. But we do have to try, and we have to see what's going to resonate with folks. I know a lot of people said, some people don't think their responsibility to the community is motivation enough to get vaccinated. So that may not work with some people. But if you say, if you get vaccinated, it'll keep you out of the hospital, it'll keep you from dying, that might resonate with some people. It might resonate with people that if you get vaccinated, you can feel safer going to visit your elderly grandparents, at their nursing home, and not giving them, COVID. You don't want to spread it to your children. That's another motivation. People are motivated by a lot of different things, and it's very difficult to, get into a reasonable conversation if people have made up their minds. But don't get too deep into the weeds with folks who have their mind made up. We're trying to get people to get vaccinated, and hopefully, repetition will work, and the facts will work, and getting the information out there. People who said they were waiting to see what's happening. Well, we've had 6 million people, I believe, vaccinated in the US. So 6 million people have gotten vaccinated. It hasn't really turned out that badly. So, maybe those folks who were waiting can actually be convinced to, get out there and get vaccinated. So, all right. Well, I think, let's see. So I just wanted to kind of wrap it up here. Changing health behavior is a challenge. We've talked about some of the obstacles that you have to overcome. Do things like engaging in active listening and empathizing with folks to get them to listen to you and be genuine and have, so that they can trust you. And in emergencies, use risk communications principles that we talked about, getting the right message to the right people at the right time so they can make the decision to do the right thing. And then answering your questions thoughtfully that you get from folks. Make sure you're concentrating on what they're asking you, recognizing their frustrations, and then communicating empathy and compassion to people is so important, because you're a person of authority when you're helping out people. So, and then referring to resources where appropriate. Again, if you don't know the answer, talk to your MRC coordinator or someone else who's in charge at the event that you're in, or that you're at, or refer them to the resources for COVID, the website, or the 800-877 number. And I believe that would be it. So I'll turn this back over to Adrinia. I don't think there was anything else in the chat that I needed to address at this point.
Great. Thank you, Lori and Linda, for a very informative webinar on this evening. We want to thank everyone